To begin the course of online training and guide to adaptive cycling for clinicians, we'll provide a background information about adaptive cycling. Adaptive cycling is a group of activities that are performed by individuals with disabilities using cycles that are modified or custom built to suit their needs and abilities. Adaptive cycling enables mobility, promotes fitness, and enhances inclusion. Reasons that someone might consider adaptive cycling: if they have a physical or other type of disability that limits their ability to use a traditional bicycle or something that they could purchase, for example, from a sports store. Adaptive cycling can be possible for people with many types of disabilities. Adaptive cycling can reduce health disparities and increase opportunities for community integration, especially when inclusive programs are in place. Before someone would try adaptive cycling and potentially explore obtaining one for themselves, many team members could or should be involved. Depending on the setting, the type of funding, the type of disability, and the type of cycle explored, the person using the adaptive cycle, of course, is involved in all of these scenarios. But in many scenarios, medical providers to provide medical clearance, physical or occupational therapists might be involved, recreation therapists, community organizations and their representatives, manufacturer representatives, and potentially even peer mentors and others could be involved. Community organizations may be involved because they often have access to equipment where health systems may not. Manufacturer representatives can be useful and should be part of the team, as they often are the experts about the specific equipment and can provide specifications of how to measure, things to consider for specific models. The process to obtain an adaptive cycle is similar to the RESNA Wheelchair Service Provision Guide suggestion for obtaining a wheelchair. Not all steps will apply to every person in every type of scenario interested in cycling, but the examples of steps that might be involved are identification and interest of need, medical clearance, functional assessment that is typically performed by a physical or occupational therapist, equipment trial and selection, funding and exploration of education and funding, documentation, particularly if a medical system or a grant is being pursued as part of the funding, fitting and training, maintenance and repair. Because this is a course for clinicians, we'll focus on the therapist's role, although all roles are important and again may be adjusted depending on the players involved for a specific person exploring adaptive cycling. The therapist's role for evaluation and trial: they should assess physical, cognitive, and environmental factors for the person, identify appropriate cycles and types of modifications that might be needed, and facilitate trials with demo equipment. This will help maintain safety and confirm the right match before investing in equipment, reducing the risk of abandonment. For procurement and funding, therapists help navigate the complex process of acquiring adaptive cycles. Their documentation and advocacy are often key to securing insurance or grant funding. They may be involved in documenting medical necessity, assisting with funding applications, or coordinating with vendors and suppliers. Therapist roles in training and follow-up include providing training for riders and caregivers on safe use of equipment, providing ongoing support and adjustments as a person trains, and monitoring for changes over time. They may also be involved in training for maintenance and repairs if no other player in the team is involved in that. Module 2 will move on to the different types of cycles and accessories.